Hello, and welcome to my presentation on the topic of telemedicine. I'm Daniel Cho, your presenter for the next hour. Maybe a short introduction about myself. I was born and raised in Hong Kong, have been now working in Germany for the past 15 years. I'm a regular keynote speaker and also chairman in many international pricing and also innovation conferences. I was invited by Dr. Bill Chen from the Hong Kong Children's Hospital, whom I knew, respect and even admire for the past 20 plus years, to host this presentation. I will provide an overview of the technology and also development trends for telemedicine around the world, in particular towards the context of COVID-19. Before I continue, I must make a disclaimer. I'm currently the head of strategic pricing for Philips Connected Care, which is a 4.3 billion euro global healthcare business. Other than that, I have currently no tied to or receiving any incentive from any of the companies or product that I will be presenting today. And I will try my best not to include too much content from Philips. First, when we talk about telemedicine, we are talking about a lot of potential solutions over the areas of care, monitoring, treatment, etc. Telemedicine is basically applying technology to help to offer healing and care away from the provider. I will further elaborate this in the coming slides. For the technological parts, more and more we will see the application of high-definition video streaming, artificial intelligence, Internet of Things, rule-based decision support, and all of this supported by a managed platform or infrastructure that is both secure and robust. In this presentation, I'll be quoting articles from a lot of international sources. I had tried my very best to provide a reference to the article at the bottom of each slide. I will be providing such a slide set to Dr. Bill Chen so he could also find a way to share with those that are interested. You are more than welcome to use the content of my slides for training, education, and any types of non-commercial sharing within Hong Kong. Please be mindful that I could also be presenting part of this content in an international conference. So if you need to reuse those slides outside of Hong Kong, please just provide a reference to myself or Philips as a courtesy. So let's get started. To provide you a frame of reference, for the US Medicare covered community, today only about 0.25% of the reimbursement claims are related to telemedicine. Before COVID-19, the application of the technology is mainly focused on sickness that require very little monitoring and diagnoses that are heavily based on verbal questioning and testing. So as you can see from the table, these are the top 10 diseases that are currently treated by telemedicine. So you can see the focus is on depression, bipolar disorder, sleep disorder, and so forth. With the maturity of the current telemedicine technology, comes with a lot of potential applications. Take a look at the attached table, for example. Therapeutic exercise for 15 minutes can easily be set up in a video conference session with a patient. In 2015 alone, there were over 49 million such sessions in the United States. Organizations such as the Hong Kong Telemedicine Association and Hospital Authority could jointly develop a set of guidelines to its members what applications are possible and practical. Now shifting the topic a little, the success of any technical introduction is rely heavily on the initial adoption rate and how fast and far that adoption can get across the 15 to 16% point. Once you have crossed that chasm, you will see the acceleration of the adoption, and soon you will see this technology being used everywhere. Look at YouTube, smartphone, and many other social media platforms, you see the same pattern. And for those that fail, such as Google Glass, 3D TV, virtual reality, They just could not make the first 15%, and then they were being forgotten. COVID-19 had opened the door for telehealth and is pushing the adoption at a speed that we had never seen before. 90% of the hospitals act on this emerging trend and adopted some level of telemedicine solution, although 57% are only on the elemental level of screening and also triage. For example, the privately insured in US has seen 40 times higher usage after the COVID-19 started to spread. You can see a similar performance across most regions. That means COVID-19 is seen as a bridge to push beyond the few percent into the mainstream, and that helped to push for the population to cross the chasm. And seeing how easy and how efficient telemedicine is working, especially towards COVID-19 time, more and more payers are willing to extend their offer for more of their members for a longer time. There are a lot more discussion currently going on to even discuss about making telemedicine claims permanently possible and go way beyond the COVID-19 pandemic. I promised I will get back to you on the topic of the definition of telemedicine. First, I'd like to explain briefly the difference between telehealth and telemedicine, as they are being used interchangeably throughout this presentation. Telehealth is the superset of using technology as a means to push both the promotion of health as well as the treatment of sickness outside the boundary of a healthcare facility, such as a hospital or a clinic. So telehealth will contain, for example, sickness prevention, smoke cessation, or some awareness campaigns, such as webinar for obesity awareness. Telemedicine, on the other hand, focus on the medicine part, which means assessment, monitoring, diagnosis, treatment, and recovery. For the purpose of this presentation, we will focus on the three main areas of telemedicine, which is teleassessment, teleconsultancy, and telemonitoring. There are another hundreds of applications that we will not have time to cover, but they are equally important to the provider and also the patients. Our first topic is teleassessment. For our interest, we will focus on the use of chatbot and artificial intelligence in the area of screening and also triaging the patients. Chatbots are very common nowadays as a first line or frontline customer support tool that a lot of companies are deploying. With the surge of patient that is needed to interact with the hospital and doctor over some general inquiry about COVID-19, this alone had overwhelmed most of the healthcare organizations around the world, and more are seeking help from technology to solve this. Just give you an example. Imagine if only 5% of the Hong Kong population is looking for help, and they need to have a 2-minute conversation with your staff. This will mean that you have to employ 66 full-time people over an entire month just to answer this amount of queries. This amount of well-defined and repetitive task is perfect for a robot to do, that can operate also on a 24/7 each day of the year. We call this chatting robot chatbot. They are artificial intelligence apps that can provide natural language conversation on basic requests. Most of them can provide very good service within a restricted area of discussion. For example, there are chatbots for assessment of COVID-19. This is extremely popular. We can talk about that later. There are some general query on symptoms, where to get a test, and what should you do to prevent it, etc. There are apps to trace the infected and provide you alert if you had a close contact with a carrier. We will cover that as well later. And also some basic risk assessment for employee, etc. A lot of the chatbot software developments are provided by the tech giants such as Google, Microsoft, the like. They provide the components for the small players to build up a total solution. Such small niche technology players can often offer very innovative yet low-cost package solution at speed and scale. Orbiter is one of such companies. They offer different levels and types of conventional AI chatbots to their clients. They don't offer only a technical solution. They can also create marketing opportunities for different clients, pretty much like Google search engine optimization for their paid customers. For example, if a patient asks, where is the best place to get a COVID tested in his or her area? The paid hospital will pop up on top of the return list. Orbiter allows the hospital to provide the patient a pre-visit and also post-visit engagement, and provide, for example, gentle reminders of your instruction for medication, exercise, food restriction, etc. This can build up the brand loyalty of the hospital. The latest telemedicine AI solution from the UPMC, University of Pittsburgh Medical Center, will generate a smart summary of the visit so that the patient can have a very quick recap on the discussion and will not forget any details, especially important for elderly patients. So it's almost like, you can revisit your doctor's visits by not, going back to the whole video recording, but actually looking at a very well written summary, and the AI actually recognize what is important and not important, and only put the important points into a summary that you can read afterwards. Another example is from Jefferson Health, who uses chatbots to help screening their patients and even offer help to book an appointment if there's a need for admission. The entire solution only requires a few days to implement. So, how does the chat session look like while you are being screened by a chatbot? Let me provide you an example. So what you are seeing from the screen is a very typical COVID-19 screening chatbot. It will start asking questions on major symptoms, and this is used to start scoring the patients against the possibility of having the disease. Once it captures all of the symptoms, it will continue to score your risk based on your travel history or whether you had close contact with a possible COVID-19 patient. Finally, it will check your age and some parts of your medical history on what chronic condition may exist. Then they will collect all this learning and also scoring and provide you with a recommendation. So they do not call this diagnosis. It's only a recommendation or an assessment. Chatbot is a very powerful way of using AI to resolve a massive resources constraint. There are many other ways AI is currently being used to help scale up human capability and speed. For example, in the area of COVID-19, AI is widely used to provide assistance to drug and vaccine discovery, as well as forecasting and predictive modeling. One Australian company, Blue Dot, for example, had used AI to predict the outbreak based on a few publicly known sources of information, and already sent out a warning of the COVID outbreak on December 31st, 2019, weeks before the official announcement. Another application for artificial intelligence is for disease prediction or prevention. For example, US Department of Defense had just started an AI-enabled infection control project. So this AI engine can predict the infection days before the symptoms shows up. This kind of predictive algorithm will be very important in the future for tele-assessment, in particularly for high-risk patients and also chronic patients. Early warning, early consultation, early treatment will drive better population outcome. In the chart, you can see that the ranking of what people seen as the most impactful category of healthcare IT that is supporting the health system 5 years from now. It is not difficult to imagine AI is seen as number one. Telemedicine itself is also highly ranked to number 5. There is a lot of hype in the medical world on AI, and a lot of promises has been made. Unfortunately, AI is still not up to the standard for complex assessment, such as COVID-19. Casey from Health Tech Channel decided to put 8 different chatbots to the test, and he found highly distributed recommendation for him, even when he provided the exact same input. Of course, one can argue if you call different people from different locations, they most likely will also provide you with very different recommendations. Today, with the sample of nearly 3.3 million patients going through the assessment, there is an 80% accuracy for the chatbot and also AI to predict the COVID presence. I'm sure most of us will look at 20% error as too big, but with the current constraints in human availability, perhaps this is not the best situation or best solution at all. Of course, the algorithm can be and also should be improved by machine learning on all of the current cases. One thing that is certain, more and more clinical research will be published. These new findings can be used to obtain a high accuracy for these chatbots and also AI solutions. For example, now we know the chance of having COVID-19 is 90% when more than one symptom exists. So rather than checking individual clue, the combination of the clues may improve the predictive accuracy. I did mention about this tracing app in the beginning. This is also soon to be available from Apple and Android phones. This is the first publicly available COVID tracing app in the world and is developed in Switzerland. The owner of the app will get a notification if they had close contact, which is within a Bluetooth distance, with a carrier. The beauty of the design is that it does not have to remember where you meet, who you meet, and how long you meet that person. It only remember 2 numbers had made a match. And if one of the number had now confirmed it with COVID, the owner of the other number in the pair had to be notified. It is extremely effective, and yet everyone's privacy will be protected. Unfortunately, we are not doing this on a live event, so I cannot have an active engagement with you all. But maybe Dr. Chen can consider running a small panel discussion over this topic later. For example, so how do you build chatbots? Who is responsible? Who will kind of look after it? And also, how likely do you believe the Hong Kong public will use this kind of chatbots? And also what is needed to enhance the consumption, and also, of course, the language may be an issue. So how do you create and construct a Chinese chatbot, and do you need to also do it in multiple character sets, and so forth? So that may be worth kind of discussing. So we can start the second topic. So it's about teleconsultancy. Teleconsultancy basically is really replacing a face-to-face consultancy session, mainly with the technology of video conferencing, and also allow people to book an appointment, and also find their physician almost round the clock. So most of you know this is not a new technology, so this is available in many markets already, in particular in China, for quite a long time. There is a lot of advantage of using teleconsultancy, of course, over the other way of doing consultancy. and we can discuss this later. As I mentioned earlier, teleconsultancy is really very mature in China. The leading company, Ping An, has now more than 300 million registered users, which is roughly 20% of the entire population. Telemedicine is blooming across APAC. Thailand is currently investing a lot to become the international medical hub by leading in telehealth. They have currently already attracted a lot of patients from their neighboring countries. Telemedicine adoption is also being pushed by many large employers, especially in the United States, in order to have a better control in medical expenditure for the company. Up to 60% of the US large employers provide coverage for telemedicine. Cost to have a telemedicine visit is costing only about US $40 versus a typical in-office visit of about $125. Not only hospitals and employers are interested in pushing for telemedicine. Even the insurance payer can see the advantage. For example, AXA started to offer telemedicine service to 6.5 million members in Asia for some 24 hours by 7 teleconsultancy services. What AXA provided is a cross-border service, mainly provided by the team from Tencent Telehealth. In US, pharmacy groups such as CVS, whom own nearly 10,000 retail pharmacies in US, a little bit similar to Watson's in Hong Kong, is also providing a teleconsultancy service called Minute Clinic, and had grew the number of visits by about 600% during the COVID-19 period. Hong Kong started telemedicine back in 1998, mainly targeting patients in elderly homes. This had been recently expanded to psychiatric patients and also those in need of physiotherapies. Despite the fast acceptance from patients and also adoptions from companies and countries, there are still some regulatory challenges remain for Hong Kong to prevent the growth of telemedicine. In December 2019, the Medical Council of Hong Kong issued ethical guidelines on practice of telemedicine. This is to provide guidance to doctors who wish to engage in telemedicine. Contravention may render a doctor liable to disciplinary proceedings. So there need to be a safe harbor for the recommended limited use of telemedicine, because only then this will make it safer and easier for the adoption and also providing a fast and sustainable growth. Despite the challenges we just mentioned, Henry Young from Hong Kong Doctors Union commented that the inquiry about telemedicine from doctors and patients alike had risen by about 10% recently. There was also a recent launch of a Chinese telemedicine platform by Dr. Now in Hong Kong, which patient can have a virtual visit with listed doctor from anywhere in the world. I myself had created an account and I could get in and make an appointment from Germany. It was very easy and professional. Sorry, but I could not find the English article for this. Queen Elizabeth Hospital had just launched a new telemedicine platform that allowed patients to make an appointment, to do a self-identification, and also have the video consultation using an all-in-one platform. All 8 patients in the pilot test are happy with the experience. Teleconsultancy generated a big demand on network throughput to support real-time high-definition video streaming. In US, the government is funding through FCC to the rural hospitals, though they are able to upgrade their current network infrastructure to support telemedicine. One clear advantage of teleconsultancy is to provide access to physicians from difficult to reach areas. And since it's virtual, there is hardly any way to prevent cross-border service to come into play. And I'm sure there will be a big debate for having cross-border services. And here I provided some discussion points for why you need to stop it or how you want to discuss about stopping it. Because there are certain reasons that you want to have a in-border service providing for your patients. Teleconsultancy is not only limited to patients at home or elderly homes. Many US hospitals also implement teleconsultancy with inpatients. For example, Banner Health. They launched this for 28 of their hospitals across United States and include as well patients from the emergency rooms. Now, we can see that there's already a substantial investment and interest from the employer, provider, and the payer side. How about the patients? What is their thoughts behind this new rising teleconsultancy trend? There was a very recent consumer report just released that has a very detailed interview with 2,000 respondents across the United States. It was conducted between March 19th to 20th of the 2020. Let's take a look at the results. The first question was on, do you know if your health insurance provider offers telehealth services? There are more than 50% of respondents being informed about the telehealth services, and other 10% knew their insurance provider does not have such a service. The additional opportunity is the remaining 35% of people that are not being informed. For Hong Kong, this may mean advice or active promotion through social media, TV, and also paper media. Most effective will be social media, as you can include a promotion video article and the direct link going into the landing page and ask people to start subscribing to such a service. On the question, have you ever considered trying a telehealth appointment? If you look at the distribution of the respondent between the one that already tried, 20%, willing to try but not yet, 40%, and those that hesitate but may consider it when they needed it, which is the last 40%. The ratio fit almost perfectly into the crossing the Chasm model, which is 16%, 30, and 30. The slight shift towards the left most likely was contributed by the COVID-19 situation. Since they had already crossed the Chasm, it's very likely telehealth will continue to be successful for the US market. Here again, you had raised a few questions for you to consider. How can you help the patients to cross the chasm in Hong Kong? What can you do to move them towards the left side of the curve? Is it possible to provide some kind of incentive or free trial or give them incremental services or force it through the recommendation of the doctors or creating a mandate for certain types of visits? So all these options are available. So next time when you have a chance to discuss among yourself, do talk about these topics because you need to move the people across that 15-16% line. One possible example Hong Kong can follow is the Swiss model. The Swiss government had decided to pay for the COVID tests if it is recommended by the app. Under the same principle, if HA is offering some reduction in charges for certain service or treatment via telehealth, either through the assessment or the consultancy, then it will help to push through the 16% faster. The next question is, would you consider scheduling another telehealth appointment in the future? It is not a surprise that 96% of the patients will consider using telehealth again. once they had the first experience. 60% even already taking a second time. This shows that when executed correctly, the patient satisfaction of telehealth is very high. So for example, a free or a promotional fee will work very well. Once you get them on board once, a lot of them will come back for more. The next question is, besides availability and affordability, which of the following would most lead you to make a future telehealth appointment? So no need to commute and also reduce risk to be in contact with other patients are the main drivers for telehealth. Together, this is over 70% of the people. Another 12% is for the same day round-the-clock service. Now with the question, which of the following may deter you from making a future telehealth appointment? For the people that are not going to pick telehealth as an option, they are either not convinced the care can deliver effective over the distance, which is 41%, or they have a preference to meet the doctor in person, 36%. Some do worry that they will be contacting a doctor they never met before, 23%, and a big 12% is worried about cybersecurity. About 10% either resist due to the technology requirement or they do not wish to install an app into their own device. Now with what do you view as the main advantage of telehealth services? A big 38% like the access, the care quickly when needed. 21% enjoy the avoidance of a crowd. There are 16% each on the two very similar topics, which is better access from the remote areas and also no need to commute. Last but not least, taking less time off work is important for 7% of the people. When asked the question, does anything in particular concern you about telehealth services? For the main concern, there is 41% each for the questioning the quality of the service and also the accuracy of the diagnosis. 26% worry about privacy and cybersecurity, and a further 17% worry that the appointment is being recorded. If you think that the concern about recording and cybersecurity is excessive, think again, as there are a lot of news over this topic recently. This one is the most worrying. The video recording of 50 patients was accidentally made available for access by a different patient. Just imagine if these are celebrities, colleagues, or the exam is on private body parts. This can be a real serious problem. Health data is a very attractive target for cybercriminals. Highly skilled hackers can break into databases that hold important and sensitive patient data as short as 8 hours. A company called WizCase has successfully hacked into 9 medical databases. So the holder of such key data should invest more to secure this sensitive information. There's a very new article to help CIOs and also CSIOs to build up the capability of cyber defense. When asked the question, do you feel that people get comparable healthcare through telehealth as they do for in-person visits? 31% believe the care is comparable. Another 32% believe it's a very good option for basic care. But unfortunately, there are still 25% of the people not convinced that telehealth can match the same quality of in-person visits. When asked specifically for COVID-19, telehealth services are being used to remotely screen patients for coronavirus. If you show symptoms for COVID-19, would you consider using a telehealth service if it were available and affordable to you? 85% will consider using it if it's available and affordable during the COVID-19 time. And has the COVID-19 pandemic increased people's willingness to try telehealth in the future? 60% had increased such a willingness to use teleconsultancy in the future, mainly influenced by COVID-19. Again, I'd like to bring a few points for your future panel discussions. So these points are my personal opinion, totally without research backing them up. These are some areas I believe can benefit a certain group of doctors when they are shifting from office-based consultation to teleconsultation. And these are some points that may benefit certain groups of patients more than the others. I particularly believe aged patients, either supported by their caretakers or living independently, will be the most beneficial group. And this is a slightly different topic. Should there be a way to match the doctors to the patients over some preferential profiles, such as gender, language, or even age? If so, what are the most important profiles? So I'm coming from Germany, so basically this kind of rating websites are available, very common. So, your patient is allowed to rank you after the visit, and you then get a score. For example, the one at the top, Sebastian, so he had a score of 4.2, versus another doctor at the bottom, Uta, who has a score of 4.4. So this is very common in Germany. I don't know whether this is applicable also for the Hong Kong physicians. So I'm checking also this Hong Kong solution called Dr. Now, who also provides some kind of a ranking system to the physicians. But as you can see, almost everyone get a 5-star, so it's not really useful, as a way to differentiate the services, since everyone always has 5 stars. So it will be nicer if, there is a real differential. And then based on real customer feedback, of course, you can also make it up yourself, or call someone to, call in and rank you very highly. So if it's a fair ranking system that can actually differentiate the service, it will be really good as a consumer of the service like myself to then seek, the high quality service that I really looking for. So finally, we come to our last topic, telemonitoring. It is in many ways very similar to the requirement of the teleconsultancy. So who actually will benefit from remote patient monitoring? So it's still the seniors and or the one with chronic illness or people with certain disabilities. Of course, for people that live far, far away from the hospitals are the people that really will benefit from, remote monitoring, similar to what they have for teleconsultancy. Telemonitoring or remote monitoring is a highly profitable and growing market. Today is definitely underdeveloped. So there are a lot of people that has, a certain age, like 60 plus. There will be roughly about 2 billion of them will become 80 years and above. And of course, all these people are susceptible to a lot of very worrying diseases, such like ischemic heart disease, stroke, and COPD, and lower respiratory infections. So all this require a very detailed monitoring in order to prevent, certain things to happen without noticing, and they will have definitely a fatal outcome. So these are patients that definitely could benefit from such a service. And as more and more such equipment is available at a very, very attractive cost. So this market will continue to grow. So how do you build up a telemonitoring platform? So basically you do need, of course, a single data center, and then also the streaming of this data towards that data center, and from that data center also able to collect the information from the devices itself into a mobile device such like your phone or an iPad, in order to transmit this data to the central database that can be shared towards then the hospital, the physicians, and also the electronic health record. So, and a lot of them will start implementing artificial intelligence in order to interpret the data and provide maybe an early warning in case certain situation is developing in the wrong direction. There are a lot of very interesting development in the technological side on having monitoring outside of the hospital. So one of the more interesting solution is what is called the Sleep Easy, contactless sleep monitoring. So basically it's a very small box cube that can be placed next to you when you are sleeping, and it measures your breathing, it measures your heart rate, it measures your movement in real time, and they collect and then send this information to your doctor, and to also let him understand your sleeping pattern, and also how your body is responding. More and more, the technological side is developing what is called contactless monitoring. So because, especially for the senior patients, though they will not remember to wear a device, they will not remember that they need to measure themselves using the device, or even they may forget to put in a battery so that they cannot use the device. There are many, many reasons that you want to make it almost like seamless, and also you need no effort to continue monitoring the senior patients, especially if they are alone, living independently, and if you want to measure and also report that data trend and also prevent certain things to happen, this is actually the best technology. So a lot of such development is going on. So being able to measure a single patient, through the radar or through radio frequency, so almost like your Wi-Fi network. And if you do a dual access point, you can actually focus on a patient and measuring his respiration and also heart rate and certain movement. So more and more people are asking, so what if I have more than one person at home? So can I still able to actively measure and monitor them? The answer is yes. So basically now there is a new radar-based sensor which can measure contactless from a patient and more than one patient, so up to 4 patients in real time. My question is, can you actually provide also the active identification of that person? Because if you know someone has a problem, but if you cannot tell which person has that problem, to me it's still not a suitable solution. So what I'm telling you is not science fiction. So there's already a commercial product available from this Ventilator. It is using a micro radar system that is able to detect the patient information, and from the right you can see it can pick up your heartbeat and also your respiration rate, the heart rate variability, and also the depth of your respiration. So all this is currently already available as a commercial product. And if you want to measure way beyond the very basic parameters, and you also want to provide some flexibility for the physician to say, okay, I need this parameter versus that parameters, there is already a lot of such platform available. For example, to measure continuous blood pressure, to look at blood oxygen level, to also look at your Untitled CO2, and of course the cardiac output, even stroke volume. and calculating early warning scores. I mean, all these parameters and also technology is already available commercially. So one company called Caredica is actually a provider of that service also to a lot of the Australian hospitals during COVID to provide such home monitoring for a lot of patients. So of course, depending on the need of the patients, so there are a lot more vendors trying to target those patients in a very specific way. So you see, for example, oxygen monitor based on a ring. So instead of a watch or a cuff, it is actually putting into your thumb. You have kits, oxygen monitor. You have also specialized sleep oxygen monitor and so forth. So very, very targeted and specialized equipment are already available. So this is a solution called Early Sense, which is another contactless sleep monitoring device that is placed underneath your mattress. So it's highly used already in hospitals around the world. But more and more, due to the lowering of the cost, it is made also available as a home monitoring device. As you can see, they give you even sleep stages analysis, like your rapid eye movement, light sleep, how much percentage, and also looking at your physical statistics on heart rate and so forth. It's very, very professional and also really well developed. Other contactless technology available also through camera. So through a camera, people already can start testing your heart rate and also certain respiratory rates, and even at some stage you can get also the oxygen content of the person. This is a Hong Kong-based solution. It's very, very advanced, looking into the electrical impedance of the lung and checking where there are infection and also water trapped into the lung. It's extremely nice solution that is yet to be released, but I believe this most likely will come into a very, very nice monitoring for the future. And more you will also hear the word wearable sensors. So those are very, very tiny sensors that you can put onto your body and most likely come into the size of a pet, and then they will measure a lot of different parameters. And also send this through the wireless network to the electronic medical record. And not only is just measuring the patient, it's also one way to help you to also connect yourself and as a physician to the device that deliver the therapy, such as the ventilator. So you can actually change the setting of the therapy system based on also the the parameters from your patient. Also, more and more, there are a lot of real-time measurement of certain key parameters like glucose level. I mean, with the Abbott Freestyle Libre system, you can actually track the development of your glucose on a real-time basis. With the real-time monitoring of the glucose, they also can use this through an artificial intelligence engine and able to predict your glucose level up to 1 hour. So when it's elevated to a dangerous level, you get actually a warning up to 1 hour ahead of time, so you can act on it rather than only note about it when you start fainting. More and more, you also can find in a very standard, commercially available device like an iPhone or even an Apple Watch. You can already do some very advanced measurements. So Apple Watch, for example, can start measuring your rhythm and also detect irregular heart rate, and also most likely use it also to capture a short ECG strips that you can send to your doctor. And also when you have a suspicion of atrial fibrillation, you can actually capture that as well and then send it to your physician. On top of the Apple Watch, of course, there are also very professional tools that can capture 1 lead or even up to 6 lead of your ECG in real time and send those data to your cardiologist. So, they can take a look and also give recommendation. So it's extremely easy to apply. As you can see, put your fingers on top of the device, put it on your left leg, and then you can capture this 6 lead of ECG. There are different variations. So for example, you can actually see this little device you can wear on your chest the whole day, and will communicate with your phone and also allow your phone to capture your ECG strips over a long period of time. Of course, it's not just your cardiac. It's also able to now also detect the sound, and able to capture, for example, your lung sound, and also of course your heartbeat sound, and then transmit across the network. So pulmonary and also cardiac exam can be done also now across the distance. So most likely you have heard there are patients that has contraindication for certain medicine that is provided to them, to treat COVID-19, especially the one that is doing home stay and home monitoring. The possibility to have a QT elongation could be very fatal to certain patients. So a company had developed a very, very nice pad to wear on the patient that can provide a QTC or QT elongation measurements, and report that to the doctor, to watch how the response of the patient is on the drug. This is really like science fiction. This is a very small device that you can implant between the two chambers of your heart, and they can detect the pressure of the chamber, and this is then fit into a PC, and the PC can transmit all information back to your doctor. As I mentioned, there are a lot of options now to provide not just the heart sound, but also the lung sound. So especially for COVID, you can imagine, listening to the lung and suspecting a certain infection is actually very powerful over the internet. And there are actually more and more, even artificial intelligence built onto such listening and sound, and actually paint the sound in different colors for very easy pattern recognition. So you can see at the bottom that the colorization of such a sound will give the doctor very, very quick visualization of a certain pattern or problem. So today there is already ultrasound available that is connecting to your mobile device. So it already is available as a technology in the hospital. I'm sure one of these days this technology will also move to the home, or allow the traveling nurses to actually do a scan and then provide it to a cardiologist. So the very last topic is not monitoring, but actually there are even lab tests available that can send to your home, and then you can scan it, and then you can test and provide the test result directly back to your doctor. The final topic I'd like to share is my vision of a more effective telehealth system that can combine the best of the three solutions into a seamless workflow model that support a seamless patient journey through the care continuum, from wellness to sickness to wellness again. So this is my visionary model. Simply put, this is a model that tries to support the patient, his caretaker, the hospital, the lab, pharmacy, and physicians to work seamlessly into a workflow that help to bring the patient back to health. Let me walk you through this model. So it starts from the day when the patient suddenly violated some preset target for his measurements. For example, temperature is more than a certain degree that you have set for the patient. Of course, the first thing the system will go through is to ask, are you still okay? If the patient says yes, nothing wrong with me, then maybe this is now set to a new baseline, so it don't continue to ask until the baseline is changed again. Or if the patient is not really feeling okay, the chatbot should automatically, based on his medical record, provide a assessment check, especially targeting to his chronic disease or whatever that is suspecting at the time. For example, now, of course, the most common is COVID. And then if at the end of the assessment, the patient is still okay, then it also come back and adjust the baseline. If the patient is not okay, then of course, immediately the system will bring him into a consultation. So to reach the physician, and the physician, based on his medical history and also the assessment result, will start thinking, should I put this patient to the hospital or not? And of course, if yes, then you already starting the admission journey, and also maybe even book him, for the admission. If not, then he should, based on his consultation result or his own assessment, provide a treatment to the patient and also give some instruction, for him to follow. And then maybe part of the instruction is to have a follow-up, appointment with the doctor. It could be also the treatment is requiring some kind of, or the instruction requires some kind of a test, maybe, to get a blood test or to get an EKG. Then he should then, go to the laboratory and start the record, so that, to give an order so that the patient can go there and take that extra examination or test. He should also provide, of course, some medication and also instruction for those medication for the patient, and also that also go into the prescription. The prescription allow the patient or the caretaker to get that medication, through a local pharmacy or whatever, using a QR code or, using an SMS message, whatever it works. And that is actually a nice workflow. Then, after they obtained it, of course, you have to update back, your pharmacy system, and all that. And also, of course, during a consultation, the doctor may be also interested to see the trend, of his glucose level or, blood pressure level or whatever. So he should be able to also access, some vital signs trends, directly from a database. And this is where, the telemonitoring has been storing, all the measurements. And then also, of course, at every step during the treatment follow-up, all this should also write back to the health record, so people know what kind of treatment and recommendation, the physician has been giving. So the next time during a consultation, even for a different doctor, they will be able to understand how to follow up with this patient, and also, what kind of medication already issued. So this, to me, are the very basic model that may work really well when it's coordinating everything from the system point of view, from the people point of view, and the time point of view. And of course, when the patient come out and find again, it start again from the telemonitoring, and then also the assessment, and then the whole cycle start again.